We've all been there. Stuffy nose, scratchy throat, maybe a headache from the endless sneezing and coughing. So what do? You dash to the pharmacy, grab some over-the-counter cold medicine, and hope for the best. But here's the kicker. Some of those meds you trust to save the day, yeah, they don't actually do much. At least not in the way most people think. Today, we're diving into the world of OTC cold remedies. The good, the bad, and the barely useful, so you can make smarter choices when you're under the weather. First up, phenylephrine, the invisible decongestant. You've probably seen phenylephrine on the label of countless cold meds, promising quick relief from nasal congestion. But here's the inside scoop from your friendly neighborhood pharmacist. Oral phenylephrine is pretty much a placebo when it comes to clearing your nose. How come? Well, when you take phenylephrine by mouth, it gets broken down in your gut and liver before it even reaches your bloodstream. This means barely any of it makes it to your nasal blood vessels to do the job of shrinking them and reducing swelling. The science. Multiple studies have shown that oral phenylephrine performs no better than sugar pills when it comes to nasal congestion relief. So all that money you're spending, it's mostly going straight down the drain. Now don't confuse that with nasal spray phenylephrine, which is a different story. Sprayed directly into your nose, it can work, but only for a few days. Use it too long, and you risk rebound congestion, where your nose actually gets worse once you stop. Not fun. So what about other common OTC meds that don't deliver the goods? Homeopathic cold remedies. You've seen them lining the shelves, usually with fancy bottles and promises like natural and boost your immune system. Sounds great, right? The problem? Most homeopathic remedies are diluted so much they contain virtually no active ingredient. The scientific consensus is that these products don't work better than a placebo. If you want to feel better, spending your cash here isn't your best bet. Vitamin C is basically the granddaddy of cold remedies. People have been popping it like candy every time they feel the sniffles coming on. Does it work? The truth is, vitamin C does very little to prevent colds or shorten their duration if you start taking it after symptoms begin. Some studies suggest if you take it regularly before getting sick, it might shave a day or two off your cold length. That's it. So, while vitamin C is important for your overall health, megadosing once you're sick probably won't make you bounce back faster. Echinacea. The purple cone flower that's been a staple in herbal medicine cabinets forever. You might have heard it's great for colds. Some people swear by it. But clinical studies are all over the place. Some show slight benefit, others show none at all. The bottom line? It's not a reliable cold cure. Guaifenesin, the mucus thinner. Guaifenesin is the active ingredient in popular expectorants like Mucinex. The idea is that it thins mucus so you can cough it up easier. Sounds promising, right? Unfortunately, evidence for Guaifenesin's effectiveness is limited. Some people feel it helps, but studies haven't shown a big impact on mucus thickness or cough relief. If it makes you feel better and you don't mind the price, great. But don't expect a magic cure. Zinc lozenges. Zinc gets tossed around a lot in cold conversations, and with some good reason. Some research suggests zinc lozenges may shorten cold duration if you start them within 24 hours of symptom onset. The effect is modest but real. However, zinc lozenges can cause unpleasant side effects like a bad taste or nausea, and they don't work for everyone. Diphenhydramine for cough? Diphenhydramine, Benadryl, is an antihistamine often included in nighttime cold meds to help with sleep and suppress cough. It can cause drowsiness, which might help you rest, but it's not particularly effective at stopping cough compared to prescription options. Plus the dry mouth and grogginess. Not everyone's favorite trade-off. Pseudoephedrine, the real oral decongestant. Now let's talk about what actually does work. Pseudoephedrine is an oral decongestant that's been the gold standard for decades. It shrinks blood vessels in your nasal passages to reduce swelling and clear congestion. But here's the catch. Because pseudoephedrine can be used to make illegal drugs, its sale is restricted. You have to ask for it at the pharmacy counter, and there are limits on how much you can buy. Still, if you want effective oral relief and can get it legally, Pseudoephedrine is your best bet. Nasal sprays. Quick but risky. Nasal sprays like oxymetazoline work fast to relieve congestion by directly shrinking blood vessels in your nose. But beware, using them for more than 3 days in a row can cause rebound congestion, where your nose swells up worse than before. So they're great for quick relief, like before a flight or a big presentation, but not a long-term solution. So what should you do when you have a cold? Medicine is only part of the story. Sometimes the best remedies aren't pills at all. Saline nasal rinses, saltwater sprays or rinses can gently clear mucus without the risk of rebound congestion. Hydration. Drinking plenty of fluids helps thin mucus and keeps your body working well. Rest. Your immune system needs energy, so prioritize sleep and relaxation. Humidifiers. Moist air soothes irritated nasal passages and helps mucus flow. And good nutrition. A balanced diet supports immune health. Avoid smoking and irritants. These only make symptoms worse. Why do people still buy these ineffective OTC meds? Good question. There are a few reasons. Marketing is powerful. Bright packaging and bold claims make products seem like miracle cures. People want quick fixes and are willing to try almost anything to feel better fast. D. Some medications have mild placebo effects. If you believe something helps, you might feel a bit better. OTC meds are convenient and accessible, so it's easy to grab them when you're sick. The bottom line, oral phenylephrine. Probably not worth your money. Homeopathic remedies. Stick to the science and skip them. Vitamin C and Echinacea may offer minor benefits but aren't game changers. Guaifenesin possibly helps some people but not a must-have. Zinc could help a bit if started early, but watch for side effects. Pseudoephedrine, the oral decongestant that really works if you can get it. Nasal sprays, effective short-term but don't overuse. Final thoughts, smarter choices equals better relief. Next time you're sick and staring at a shelf full of cold remedies, remember, not everything that's sold works the way it promises. If you want to spend money on something effective, reach for Pseudoephedrine or a short course of a nasal spray and combine it with the basics: rest, fluids, saline rinses, and time. Your body's immune system is the real hero here, and your best medicine is often patience and care. If this helped clear the congestion around OTC meds and gave you a better idea of what really works and what doesn't, hit that subscribe button. I post pharmacist-backed health advice every Friday at 5 p.m. Mountain Standard Time. And hey, if there's a weird health myth or medication mystery you want busted, drop a comment. I'm here to help you cut through the noise and get the facts. This is Pharma-Logic, where medicine meets meaning, one smart, science-backed video at a time.